We deploy two types of patient engagement platforms. One is a waiting room television that plays content ranges from health and wellness to good diet, oftentimes related around eye care. Also plays very specific eye care educational content around things like macular degeneration or diabetic retinopathy to better educate the patient. And then we also have a patient engagement platform called Consult, which is very interactive between the doctor and the patient. So the doctor will use the board to visually educate the patient as to certain treatments, certain conditions. They can also play videos while the patient's waiting in the exam room to further educate them about what the process for this injection might be, or whatever the particular process or procedure they might be going through. So we just find that the better educated the patient is, the more engaged the patient is, the better the interaction in that unfortunately growing brief period of time that the doctor and the patient get to spend together in the exam room.
So is this it's a waiting room experience, but does it exist in any other way online, or is it really just exclusively for the waiting room?
Well, it's exclusively for the waiting room, but in the consult, which happens in the exam room, anything that the doctor does, if he annotates on a diagram or he plays a specific video, he can take that imagery and those videos and send them out as links in email form. So the patient post-visit can take a look at some of those images. They can share it with their significant other. They can watch the videos again. So again, the engagement and the education continues even after the visit.
So it seems patient education is obviously so important nowadays. And is a better educated patient a better patient?
Well, all the data indicates that the patients that are engaged throughout the visit feel that they got, for instance, a 60-minute medical appointment, as opposed to 55 minutes of waiting and a 5-minute medical appointment. So when you can engage them at home before they even come by sending them some of these videos, sending them some of this information, then the minute they walk into the practice, they're engaged in the waiting room, they get educated, they understand about some of the conditions that they experience. We highlight some procedures that they may not have known that the office can provide, and then they can get educated in the exam room. So that time when the doctor and the patient are together can be best used, not repeating information over and over again, but really getting to the heart of what's best in the best interest of the patient. And I think everyone would agree that if we educate the patient properly, that time is much better spent than if the patient just comes in after having watched 50 minutes of CNN.
Well, this is really exciting, and good luck to you. Good luck with the program, and I think it is a win-win for everybody. It's a win for the patient, it's a win for the practice, and I do appreciate your time here. Good luck to you, and this is Tom Pace reporting from iNews TV.